1. When designing a curriculum for CSCS candidates, which principle of adult learning should be prioritized to ensure engagement? A. Rote memorization. B. Self-directed exploration. C. Passive observation. D. External incentives. 2. During a mentoring session, a senior strength coach asks open-ended questions to a trainee about exercise programming. This demonstrates which communication strategy? A. Directive communication. B. Reflective listening. C. Nonverbal reinforcement. D. Linear instruction. 3. A CSCS educator includes scenario-based case studies in the program. This best aligns with which adult learning principle? A. Theory over practice. B. Relevance to real-world application. C. Abstract problem-solving only. D. Repetition without context. 4. Which evaluation method would best measure a candidate's ability to apply periodization principles in real-life strength and conditioning scenarios? A. Multiple choice exam. B. Essay-based reflection. C. Practical simulation assessment. D. Peer feedback. 5. When creating test questions for the CSCS exam, aligning items with NSCA's published domains demonstrates A. Regulatory compliance. B. Mentoring technique. C. Communication efficiency. D. Curriculum bias. 6. A CSCS mentor models appropriate spotting techniques before asking the mentee to perform them. This reflects which instructional strategy? A. Inquiry-based learning. E. Experiential learning. C. Didactic lecture. D. Independent study. 7. To maintain accreditation of the CSCS certification program, the NSCA must adhere to standards of a peer mentorship. B. Adult motivation. C. Regulatory compliance. D. Trainer preference. 8. An instructor providing detailed feedback immediately after a practical lifting assessment is applying which evaluation principle? A. Summative evaluation. B. Norm-referenced assessment. C. Formative evaluation. D. Self-assessment. 9. Which communication approach is most effective when explaining biomechanics to a diverse group of adult learners? A. Using complex jargon to maintain precision. B. Relating concepts to learners' personal training experience. C. Delivering content without audience interaction. D. Providing lengthy theoretical explanations only. 10. A curriculum designed for CSCS candidates that integrates resistance training, aerobic conditioning, and nutrition represents A. Cross-disciplinary alignment. B. Overspecialization. C. Non-compliance. D. Singular evaluation. 11. A mentor identifies a candidate's strengths in coaching cues and encourages peer teaching. This represents A. Performance bias. B. Strength-based mentoring. C. Normative comparison. D. Instructor dominance. 12. Which adult learning principle emphasizes that learners must understand why before engaging in a concept? A. Repetition. B. Relevance. C. External motivation. D. Authority. 13. When analyzing the reliability of CSCS exam questions, evaluators are most concerned with A. Test item difficulty only. B. Consistency of results across test administrations. C. Candidate motivation levels. D. Instructor presentation style. 14. A communication barrier most likely to occur when teaching advanced biomechanics concepts to CSCS candidates is A. Oversimplification of terminology. B. Cultural alignment of concepts. C. Excessive technical jargon. D. Use of multiple teaching modalities. 15. Mentoring that focuses on long-term professional development of strength coaches rather than short-term test performance aligns with A. Summative coaching. B. Holistic mentoring. C. Compliance enforcement. D. Evaluation redundancy. 16. A formative quiz after a CSCS lecture session serves to A. Rank candidates against one another. B. Provide real-time feedback for improvement. C. Replace summative assessment. D. Eliminate regulatory requirements. 17. Which method best ensures curriculum alignment with adult learning needs in CSCS preparation, including irrelevant case studies for variety? E. Customizing examples to professional contexts. C. Relying solely on memorization drills. D. Limiting flexibility of course content. 18. A candidate receives lower scores on a practical test despite demonstrating correct lifting technique. This may indicate a problem with A. Communication between evaluator and candidate. B. Candidate's motivation. C. Curriculum redundancy. D. External regulation. 19. Regulatory compliance in CSCS exam delivery requires A. Informal mentoring strategies. B. Confidentiality and standardized testing procedures. C. Candidate-driven flexibility. D. Instructor autonomy. 20. Which instructional approach helps adult learners internalize the principles of safe lifting mechanics? A. Passive video observation only. B. Interactive demonstrations with feedback. C. Sole reliance on textbook reading. D. Written memorization drills. 21. A mentoring strategy that gradually reduces support as the candidate demonstrates competency is known as A. Scaffolding. B. Direct instruction. C. Compliance monitoring. D. Norm referencing. 22. To ensure fairness in the CSCS exam, evaluation methods should prioritize A. Standardization and objectivity. B. Instructor preferences. C. Open-ended grading. D. Peer influence. 23. When a curriculum integrates continuous opportunities for reflection and self-assessment, it demonstrates A. Passive content delivery. E. Active adult learning engagement. C. Test-only focus. D. Normative communication. 24. Which of the following best describes a summative assessment in the CSCS program? A. Ongoing feedback during skill acquisition. E. Peer discussion of programming theories. C. Final certification exam at course completion. D. Self-reflection journals. 25. Which mentoring technique ensures ethical responsibility in professional practice? A. Encouraging shortcuts for quick results. E. Modeling professional conduct and accountability. C. Relying on external rewards only. D. Minimizing feedback to foster independence. 26. Effective communication in strength and conditioning instruction requires A. Clear, concise, and relevant messaging. B. Extended theoretical lectures. C. Heavy reliance on jargon. D. Limited learner participation. 27. In curriculum development, aligning training objectives with CSCS exam domains ensures A. Reduced content delivery. B. Regulatory compliance and relevance. C. Overemphasis on one subject. D. Elimination of formative assessments. 28. Which evaluation tool best assesses a candidate's ability to coach athletes effectively? A. Peer-graded quizzes. E. Multiple choice tests. C. Practical demonstration with observations. D. Written memorization exercises. 29. When a mentor provides constructive criticism framed positively, they are practicing. A. Negative reinforcement. B. Developmental feedback. C. Regulatory compliance. D. Summative grading. 30. A curriculum that incorporates diverse case studies of athlete populations demonstrates. A. Narrow curriculum focus. B. Inclusivity and relevance. C. Regulatory neglect. D. Compliance failure. 31. An instructor who adapts their teaching to a candidate's preferred learning style, visual, kinesthetic, auditory, is demonstrating. A. Communication adaptability. B. Summative assessment. C. Regulatory compliance. D. Curriculum redundancy. 32. Which principle ensures the CSCS test remains valid over time? A. Frequent alignment with current scientific evidence. E. Reducing test length. C. Increasing reliance on outdated practices. D. Minimizing regulatory involvement. 33. A mentor encouraging reflective journaling by candidates preparing for the CSCS exam is fostering. A. Self-directed learning. E. Passive compliance. C. Memorization drills. D. Instructor dominance. 34. When evaluating a CSCS candidate's ability to provide coaching cues during a squat, which evaluation approach is most appropriate? A. Written multiple choice exam. E. Oral questioning only. C. Direct observation of performance in a simulated setting. D. Peer self-reporting. 35. A CSCS mentor who integrates current peer-reviewed research into discussions with candidates is emphasizing which principle of professional development? A. Evidence-based practice. B. Memorization of outdated methods. C. Regulatory reduction. D. Passive compliance.